We are 12 hours into the government shutdown. It is the first lapse in funding in nearly 7 years. Natalie Brand is live in Washington as hundreds of thousands of workers are being impacted. Natalie?
Hi, Cindy. And happening right now on the Senate floor, there's a procedural vote that's underway to try to move forward with the Republican-backed short-term funding measure, but that is not expected to move forward at this hour. So these federal workers, they face a lot of uncertainty as leadership from both parties are blaming each other and digging into their positions.
For the first time in nearly 7 years, the federal government shut down at midnight with no sign of how long it could last.
Well, it ends when the Senate Democrats pick this bill up, passed by the House of Representatives, and vote for it.
Senate Majority Leader John Thune has signaled there are ongoing conversations with rank-and-file Democrats in an effort to convince them to break with party leadership and support the GOP's short-term funding measure.
What gives us the ability to win this argument with the American people is we're standing for what they want with health care, and they are not.
Democratic leaders say they're standing firm that a negotiation has to address their concerns over health care cuts and extending enhanced health care tax credits under the Affordable Care Act.
We inherited this really bad health care system from the last days of the Biden administration. We want to fix it. We just don't want to shut down the government while we're fixing it.
The Trump administration's Office of Management and Budget acknowledged it's difficult to predict how long a shutdown will last and directed agencies to begin shutdown operations.
The Congressional Budget Office estimates 750,000 federal workers could be furloughed each day. Essential employees, including federal law enforcement, military service members, and TSA agents, are required to continue working without pay for now. Aaron Barker works for the TSA in Atlanta.
If it gets to that point where officers can't afford to come in or have to make a decision whether to purchase medication, pay daycare, or put gas in the car to come to work, they're going to have to make that hard decision, and no one really wants to do that.
President Trump has said the shutdown could also result in layoffs and cuts of programs that don't fit with his priorities.
Now, as for services like Social Security payments, Medicare, Medicaid, the U.S. Postal Service, that is expected to continue, as well as food assistance for low-income families and children like SNAP and WIC, although there is concern that that could be impacted, those specific programs, if funding runs out, depending on how long the shutdown lasts, Cindy.
Brand, live in Washington. Natalie, thank you. And this morning, Governor Hochul spoke out against the government shutdown and had harsh words for the president.
Donald Trump admitted this yesterday. He bragged that during a shutdown, his administration could do things that are irreversible. Reduce the federal workforce, slash programs, take away benefits. That's not leadership. That's cruelty.
The governor also criticized GOP members of New York's congressional delegation, saying, quote, in putting Donald Trump first, they put New Yorkers last. And you can find expanded coverage of the government shutdown on our website. We take a look at the impacts on the military, student loans, and Social Security. It's all there on our website, cbsnewyork.com.